So our manuscript quantified the effects of corticosteroids use on zoster risk by dose and the duration of effects in a population-based prospective cohort. Hello, my name is Jiahui Qian. I'm from the University of New South Wales. I'd like to talk about our manuscript entitled Corticosteroid Use and Risk Herpes Zoster in a Population-Based Cohort. This study will appear in the November 2021 issue of Mayo Clinic Proceedings. Basically, there are three takeaway messages. The first message is that zoster risk increased by 60% in users of systemic corticosteroids and 21% in users of inhaled corticosteroids compared to those not using corticosteroids. The second message is that the risk of zoster increased with higher doses of corticosteroid, and it was highest in the months after commencing use. And also, the risk increased in both the general population and also those with comorbidities. Our last message is that it is important for clinicians to be aware of the potential zoster which is related to the corticosteroids use, and to prescribe corticosteroids using as lower dose and a shorter course as possible. So we conducted this study using the 45 and up study, a population-based cohort study of individuals aged 45 years and older in the state of New South Wales, Australia. And for this study, we linked participants' survey data to their pharmaceutical, hospital admission, medical care, and death data from 2004 to 2015. In the analysis, a total of 94,677 participants were included. The median follow-up period was 7 years. We first classified participants into non-users, past users, and new users of systemic corticosteroids based on their pharmaceutical dispensing data. So past users use systemic corticosteroids before the study recruitment, and new users were those who have no previous use before study recruitment, but they started using it during follow-up. We found that compared to non-users, the risk of zoster was elevated in both the past users and new users. We even found a 17% increase in zoster risk among those who used corticosteroids more than once ago before the study recruitment. We further classified new users into different categories by their cumulative dose of prednisolone equivalents, from less than 500 milligram to over 1,000 milligram. An increased zoster risk was found even in the lowest cumulative group. And also it's increased with higher doses. To be more specific, the relative risk of zoster was estimated to be increased about 3% for every 100 milligram increase in the cumulative prednisolone equivalents. This finding reinforced the importance to use corticosteroids as judiciously as possible. And also for countries where the life attenuated zoster is still in use, our findings suggest a careful pre-vaccine assessment for those who are using the low-dose corticosteroids treatment. We also measured the effects of a single prescription of systemic corticosteroids on zoster risk. We found that the highest risk was in the first month immediately following a single prescription. This may suggest that immunosuppression from corticosteroids use is associated with the failure to suppress the latent varicose virus. For more localized use of corticosteroids, we found a 21% higher zoster risk among inhaled corticosteroids users compared to non-users, and there was no increase in risk in injectable corticosteroids users. But for this localized use corticosteroids, their role on zoster risk may need further exploration because we lack information on how they are actually used in practice with this pharmaceutical dispensing data. So yeah, that's the main findings of this study. Thanks very much for your attention, and I hope you enjoy reading this article.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.